I've always been interested in going into something in healthcare. As I grew older, part of it was that I saw how there was a lack of Indigenous representation in areas like dietetics, for example. I graduated in 2020, and from there I worked with Siksika Health Services. And so when I first got there, I didn't have my certified diabetes education at the time, but I was still working with some diabetes clients, and Okaki was part of that as well. And then I got my certification in 2023, and that's when I started to do more of that diabetes education. And to get my certification, Okaki was actually very helpful because they had this program to help to prepare for the diabetes test. And so that was really helpful in breaking down those hard concepts into easy, digestible, understandable pieces. So that really helped me to prepare. I think too, when it comes to resources and support, so in a clinic, a lot of times providers are overloaded with clients, and so it can be difficult to spend enough time with the client to be able to provide them with enough education and support that they need to feel confident with diabetes. I have some clients, even if it's just weather-wise, right? So because the roads can get quite bad too, and so even if they wanted to attend the appointment but they can't because of things like that, or someone else is using the vehicle and they can't make their appointment anymore, then if they had the virtual option, then that would be something that they can do, and then they can still continue the appointment instead of having to rebook it and possibly having to wait another month before they get in. So I think when it comes to those barriers to transportation too, clients with diabetes, a lot of times they're having to not just to go to the clinic in the community to see their family doctor, but they often have to go to other specialists, so eye doctor, podiatrist, endocrinologist, things like that. And so they're likely having to travel to the city or other areas and long distances. So this can put a barrier. And it's also a lot for them to have to travel all the time. So this service can be helpful to reduce that barrier. I think when it comes to diabetes care as well, we need to acknowledge both the cultural needs and the medical needs. And I think Okaki helps to support this. These services are accessible, they're culturally sensitive. They have a whole team of specialists, so this provides clients with well-rounded care. If I, for some reason, can't see the client, or if it's something that's out of my scope, so maybe that's insulin pumps or something like that, then I refer to them, and then they're able to provide that education for the client. I think because diabetes is one of the biggest health concerns in Indigenous communities, I think Okaki is a great service because of this, because it focuses solely on diabetes. When clients are starting insulin, or if they have type 1 diabetes, for example, sometimes this can be something that's, it can be scary for a client to first be starting on that. So when you have a service that you're able to access more frequently, and you're still able to see the person face to face through the screen, then it could provide them with more that peace of mind to know that they're doing it properly, and they're seeing that provider more often to know what to do with their insulin, how to manage it, how to titrate it, all of that. It helps to bridge that gap in services as well, and it also helps to remove some barriers because you're able to access this service virtually as well. Overall, I think it's a great service, and I think it'll only grow from here.